Gateway Community Services emerged as a crucial resource in Maine, filling a gap that had long existed for many of the state's most vulnerable residents. The organization became especially vital for immigrant and refugee communities, with a particular focus on those of Somali descent, who often faced unique challenges in accessing care and support. Based in Portland, Gateway provided a wide range of behavioral health services, as well as support for individuals with intellectual and developmental disabilities, helping clients navigate complex systems and improve their quality of life. The organization's staff often shared the same cultural background and language as its clients, which helped build trust, break down barriers, and make care more accessible and effective. Gateway was founded by Abdullahi Ali, a Somali-born U.S. citizen who arrived as a refugee in 2009. Drawing on his own experiences, Ali built Gateway into a major employer and a powerful symbol of community integration and hope for new Mainers. Its rapid growth was fueled by public funding, primarily through Maine Care, the state's Medicaid program for low-income residents, which allowed Gateway to serve thousands who might otherwise have gone without care. By billing Maine Care, Gateway was able to expand quickly, opening new offices across the region and reaching a growing number of people who depended on its services for their health and well-being. However, the company's reliance on public funds also brought increased state oversight and a complex web of regulations that Gateway had to navigate. Gateway's reputation as a welcoming community hub and a success story for Maine's Somali population made it a trusted provider, not just for healthcare, but for a sense of belonging. The organization's role extended well beyond healthcare, offering jobs, training, and representing economic development and opportunity for new Mainers seeking to build a life in Maine. The trust placed in Gateway by both clients and the state was significant, reflecting years of relationship building and shared goals. That's why the later allegations of misconduct sent shockwaves through the community, leaving many to question what had gone wrong. The company's story, once celebrated as a model for integration and success, would soon be overshadowed by controversy and doubt. The stage was set for a dramatic turn in Gateway's journey as the community braced for what would come next. In late 2025, Maine's Department of Health and Human Services abruptly suspended all Maine Care payments to Gateway Community Services. The move followed credible allegations of fraud, including improper billing and services that were never delivered. A formal notice of violation was sent to Gateway's leadership, effectively crippling the organization's operations. The state's action was a response to mounting evidence of systematic defrauding of the Maine Care system. The allegations included phantom billing, charging for services never provided, and falsified records. With taxpayer money at stake, the state's priority was to halt further misuse and launch a thorough investigation. The suspension marked a turning point, leaving Gateway, its employees, and thousands of clients in limbo. The message was clear: fraud would be met with swift and severe consequences. The future of Gateway, and the people who relied on it, was suddenly uncertain. The financial stakes in the Gateway case are enormous. Between 2019 and 2024, Maine Care paid Gateway nearly $29 million, highlighting the scale of its operations. The state is now auditing years of billing records to determine how much of that money was obtained fraudulently. An initial review seeks to recover over $1 million from 2021 and 2022 alone, but officials warn the total could rise. Gateway also received nearly $700,000 in federal Paycheck Protection Program funds during the pandemic, intended to preserve jobs. Now, both state and federal funds are under scrutiny as investigators trace the flow of public money. The allegations raise serious questions about Gateway's stewardship of taxpayer dollars. Auditors face the complex task of untangling years of financial transactions. The outcome will determine not just the money recovered, but the broader impact on public trust. The case against Gateway gained momentum when former employee Chris Bernardini blew the whistle. Bernardini described a pattern of staff not showing up for appointments, yet the company billed Maine Care as if services were provided. He alleged that Gateway's electronic monitoring system, meant to verify staff visits, was manipulated to falsify records. These claims suggested not just billing errors but deliberate fraud and neglect of vulnerable clients. Bernardini's testimony gave investigators a roadmap, turning suspicions into actionable evidence. His courage in coming forward became a cornerstone of the state's case. Whistleblowers like Bernardini are vital in exposing fraud that might otherwise remain hidden. At the center of Gateway's story is Abdullahi Ali, its founder and owner. Ali is a figure whose journey has inspired many, both within Maine's immigrant community and beyond. Arriving in the United States as a Somali refugee in 2009, Ali faced the daunting challenges of starting over in a new country. Overcoming language barriers and cultural differences, he worked tirelessly to build a new life. His rise to become a Maine business leader was once seen as a model of the American dream, a testament to resilience and ambition. Drawing on his own experiences, Ali founded Gateway to serve immigrants and refugees, aiming to bridge gaps in healthcare and social services. He became a trusted advocate, leveraging his background to meet the unique needs of New Mainers. In 2024, Ali made headlines by running for president of Somalia's Jubaland region, revealing political ambitions that reached far beyond Maine. His campaign energized supporters both in the U.S. and abroad. This unexpected move raised questions about the source of his campaign funding, especially as Gateway was receiving millions in U.S. public funds to support vulnerable populations. Now, investigators are examining whether healthcare dollars meant for local services were diverted to support political activities overseas, a possibility that has alarmed both officials and the public. Ali's dual roles, as a Maine healthcare provider and Somali political candidate, have become a focal point of the investigation, raising concerns about conflicts of interest and accountability. The case now has international implications, with Ali's finances, business dealings, and global connections under intense scrutiny from both American and Somali authorities. Understanding Ali's story is key to unraveling the complex web of allegations and to understanding the broader challenges facing immigrant-led organizations. His remarkable rise from refugee to CEO and political hopeful is now under a microscope as investigators and the public seek answers about his actions and intentions. The Gateway scandal in Maine echoes a massive fraud case in Minnesota known as the Feeding Our Future scandal. There, hundreds of millions meant for child nutrition were stolen through phantom services and shell companies, many involving Somali American defendants. The Minnesota case raised fears of community backlash and even suggested links to international terrorism financing, including al-Shabaab. The parallels are striking. Both cases involve alleged phantom billing, public funds, and concerns about money flowing overseas. With Abdullahi Ali's political ties in Somalia, Maine investigators are alert to any signs of similar patterns. The Minnesota case has set a precedent, prompting federal agencies to watch Maine closely. Authorities are now looking for evidence of shell companies, overseas transfers, or direct links between the two scandals. The stakes have grown from local fraud to potential national security concerns. The Gateway case has caught the attention of lawmakers in Washington, D.C., elevating it to a national issue. Representative James Comer, a key congressional oversight leader, flagged Gateway and its owner in a letter to the U.S. Treasury Secretary. The letter expressed concern about widespread fraud in programs serving immigrant communities, drawing a direct line to the Minnesota scandal. Congressional involvement signals a possible escalation, with the potential for subpoenas and federal hearings. The scrutiny now extends beyond Maine, raising questions about oversight of public funds nationwide. Lawmakers are probing whether current safeguards are enough to prevent fraud in Medicaid and relief programs. The investigation could expand to other organizations and individuals, especially those with similar funding streams. The Gateway case is now a test of the government's ability to police its own programs. Facing mounting allegations, Gateway Community Services has retained legal counsel and issued a public statement. Attorney Pavel Binsisk acknowledged the state's notice and promised cooperation with the investigation. This stance aims to project transparency and avoid further penalties, but stands in stark contrast to the gravity of the charges. The Maine Attorney General's office has declined to comment, citing the ongoing investigation. True cooperation would mean full access to Gateway's records and communications. For now, the public hears two narratives: the state's allegations of multi-million-dollar fraud, and Gateway's assurance of cooperation. The company's actions in the coming months will reveal which story holds true. The truth will be determined by the evidence investigators uncover. The Gateway investigation leaves a cloud of uncertainty over the company, its employees, and thousands of clients who depend on its services every day. The shockwaves are being felt not just within the organization, but throughout the broader nonprofit sector. With funding cut off, the state must scramble to ensure vulnerable clients continue receiving care. Agencies are working overtime to find alternative providers and prevent any disruption in essential services for those most at risk. The scandal threatens to erode trust in other nonprofits, especially those serving immigrant communities who already face barriers to accessing support. Many organizations now worry about increased skepticism from donors and the public. Lawmakers may respond with stricter oversight and more frequent audits, creating new challenges for small organizations that often lack the resources to navigate complex regulations. The case will set a precedent for how states monitor Medicaid providers and balance trust with accountability, potentially reshaping the relationship between government and nonprofits for years to come. If the fraud is proven, it will expose critical weaknesses in oversight and force systemic change, prompting a re-evaluation of how public funds are managed and safeguarded. The outcome could reshape how public funds are distributed and monitored nationwide, influencing policy decisions far beyond this single case. The investigation is ongoing, and criminal charges remain possible. Authorities are determined to uncover the full extent of any wrongdoing and hold those responsible accountable. The Gateway case is a stark reminder of the risks in large-scale public funding, highlighting the need for vigilance, transparency, and robust oversight at every level. Its resolution will be closely watched by officials and nonprofits across the country as they look for lessons to prevent similar crises in the future.